Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Multiple choice question. A bronchodilator response can be distinguished from random variation of the measurement with the 95% certainty when the forced expiratory volume in 1 second, FEV1, increases by A. greater than 5% and greater than 100 mils, B. greater than 10% and greater than 200 mils, C. greater than 12% and greater than 200 mils, D. greater than 15% and greater than 250 mils. And the answer is C. greater than 12% and greater than 200 mils. In studies of patients with obstructive lung disease, a change in FEV1 less than 12% may occur as the result of repeat testing or in response to placebo administration. A change in FEV1 12% or more is an effect of bronchodilator administration and not random variation with 95% certainty. If the initial FEV1 was low, for example 0.6 liters, a 12% increase in FEV1 would involve a trivial challenge. For this reason, the definition of a significant post-bronchodilator increase in FEV1 includes an absolute increase of at least 200 mils. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.